I am Dr. Somanath Vasudeva. I am the head of the Department of Apollo Institute of Neurosciences, Mysore. We deal in a lot of neurological cases like stroke, epilepsy, neuromuscular disorders, and brain and spine disorders. Of that, one of the most important and most serious diseases that we treat here is stroke. We have been talking about stroke in so many fora. Today I'm going to talk to you about the stroke in the young. About 10% of patients with stroke are below the age of 45 years. That's what we call as stroke in the young. And getting a stroke at that age is a devastating event, both for the family and for the society as well as for the individual. The symptoms of stroke are the same in the young as well as in the old. That means that they can come with the sudden onset of weakness of one half of the body, paralysis of a limb, one or two limbs, or loss of sensation in one half of the body, sudden stoppage of speech, loss of speech and language. That means inability to communicate. They will also be having difficulty in walking, unsteadiness while walking. So there are so many symptoms of stroke. The symptoms would remain the same in the young too, but the differences in the stroke in young and in the elderly is in the cause of the stroke. Most of the causes of stroke in the elderly, like diabetes, hypertension, cholesterol, smoking, alcohol, heart disease, and diseases in the blood, are all applicable for stroke in the young also. But there are some unique causes for stroke in the young, like some genetic conditions in the blood due to which the blood clots without any reason. So we need to identify these causes of stroke in the young and treat them accordingly. Sometimes these young people may have to be put on medications lifelong, but the most important treatment in our treatment against stroke is to thrombolyze the patient as early as possible, and for that to happen we need the patient to reach the hospital as early as possible. We have to complete the treatment of stroke within 3 to 4.5 hours so that they can have a very good recovery. This thrombolytic therapy is being widely used and done in our hospital, and we need the public to be aware of such a facility and aware of this treatment being there for stroke, rather than waste time going from one clinic to one hospital to other places and trying other type of treatment. So my appeal to the public is that do not waste time. Time is brain. You have to reach the hospital as early as possible so that we can offer you the treatment of thrombolysis, and these young people, this young stroke patients can get back to their feet as early as possible. Thank you very much.